My name is Yadira Viteri, short-term antimicrobial treatment for acute otitis media in young children. Definition: the acute otitis media is the viral or bacterial infection of the middle ear characterized by the presence of liquid in cavity and generally secondary to infection of the superior respiratory waves, and that particularly affects children before the age of 6 years.
Pathology of otitis media. When the eustachian tube is blocked due to allergy or infection in the upper part of the respiratory tract, fluid accumulates in the middle ear behind the eardrum. This causes an infection and the middle ear gets inflamed, a condition known as otitis media. The buildup of pressurized pus in the middle ear causes earache, swelling, and redness. Since the eardrum cannot vibrate properly, one has decreased hearing. Also, there is a feeling of fullness or pressure in the ear with dizziness, loss of balance, nausea, vomiting, and fever. Sometimes the eardrum ruptures and pus drains out of the ear. But more commonly, the pus and mucus remain in the middle ear due to the swollen and inflamed eustachian tube. This condition is serious because of the severe earache and hearing loss it can create. Hearing loss, especially in children, may impair learning capacity and even delay speech development. Otitis media is also serious because the infection can spread to nearby structures in the head. Thus, it is very important to recognize the symptoms of middle ear infections and to get immediate attention from your doctor. However, if it is treated promptly and effectively, hearing can almost always be restored to normal. Tips to prevent middle ear infections for infants. Appropriate management of colds, flu, and sore throats, and of hay fever and other allergies helps prevent middle ear infections. While breast or bottle feeding babies, avoid holding them in a horizontal position. A semi-inclined position prevents the milk from entering the eustachian tube and infecting the middle ear. Avoid contact of the baby with objects handled by people who have cold.
Approximately 18 of children will have of left one episode of acute otitis media, and between 18 and 19 will have of left one episode of otitis media with effusion before school age. Application in medicine. Antibiotic therapy may be delayed in children 2 years of age or older. The high dose of amoxicillin is the antibiotic of choice for treatment of acute otitis media in patients who are not allergic to penicillin. Children with persisting symptoms should use secondary line ion sub of amoxicillin clavulanate.
Acute otitis media is the most common indication for which children in the United States receive antibiotics. Current guidelines recommend a 10-day course of antibiotics for children under 2 years of age. But given the growing concern about antimicrobial resistance, can the duration of antimicrobial treatment be shortened without changing clinical outcomes? In this study, investigators randomized 520 children 6 to 23 months old who had acute otitis media during the respiratory infection season to treatment with 10 days of amoxicillin clavulanate or to 5 days of amoxicillin clavulanate followed by 5 days of placebo for each episode, and assessed whether the reduced duration was non-inferior to the standard duration. Symptoms were tracked through the acute otitis media severity of symptoms score, which includes ear tugging, crying, irritability, difficulty sleeping, diminished activity, diminished appetite, and fever. The primary outcome was clinical failure, defined as worsening symptoms or otoscopic signs of infection, or failure to achieve resolution of symptoms and signs. Patient enrollment was stopped early when the non-inferiority endpoint was achieved. Clinical failure was seen in 34% of the children who received 5 days of antibiotics, significantly more than the 16% of children who were treated for 10 days. When both groups were combined, failure rates were found to be higher in children who were exposed to 3 or more other children for 10 or more hours per week, and higher in children with bilateral rather than unilateral infection. There was no difference between the groups in rates of recurrence, adverse events such as diarrhea or diaper dermatitis, or nasopharyngeal colonization with penicillin-resistant pathogens. The authors conclude that for acute otitis media in children 6 to 23 months old, reduced duration treatment resulted in higher rates of clinical failure without reducing adverse events or antimicrobial resistance. Full trial results are available at nejm.org.
Pros. Clinical success in more than 16 of patients with limited the duration of microbial therapy is a possible strategy to reduce the risk of antimicrobial resistance in the children with acute otitis media. Cost. Many of the children will not benefit from the treatment because the immune system will be responsible for eliminating infection without medication, which cause side effects.
If a few days after getting a cold, for example, your child is crying more than usual, is running a fever, and is possibly rubbing his or her ear, a middle ear infection might be the cause. It's quite common in young children, but will almost always heal within 2 or 3 days, even without special treatment. This video will explain how you can help your child during this time. We can only give you general information. Don't hesitate to go to your doctor early on if you have questions. In most cases, he or she will tell you not to worry and possibly prescribe a painkiller suitable for children. Antibiotics are usually not needed to treat an acute middle ear infection. We will explain why this is so and give you some other information. An acute middle ear infection is one of the most common illnesses affecting babies and young children. About 1 out of 10 children gets a middle ear infection in their first 3 months of life. A middle ear infection usually develops after a cold, sore throat, or sinus infection. The following symptoms may be signs that a young child has an acute middle ear infection. Earache, made noticeable by the child rubbing and pulling the ears or frequently shaking his or her head. Fever, several days after a cold or sore throat has started. No response to speaking or sounds of normal volume level that the child would typically react to. Irritability, frustration, restless sleep. More frequent and more intense crying than usual. Loss of appetite or vomiting. Many of these symptoms are linked to the pain that a middle ear infection can cause. This pain mostly comes from the eardrum. The middle ear is connected to the nose and throat area by what is called the auditory tube.
The auditory tube in young children is still very small and short, making it easier for germs to enter the middle ear from the nose and throat area. During an infection, the middle ear produces more fluid than it does otherwise. At the same time, the mucous membranes of the auditory tube may also swell up and block the canal. This results in the fluid not being able to drain. It then collects in the middle ear and leads to a so-called tympanic effusion. This high pressure in the middle ear can cause the eardrum to become so tightly stretched that the child will experience pain and his or her hearing will be affected. Sometimes, if the pressure in the middle ear is very high, the eardrum can also burst. The resulting rip in the eardrum usually closes on its own again, but fluid may continue to leak from the ear for several more weeks. Usually, an acute middle ear infection will heal on its own. In about 9 out of 10 children, symptoms get better after 2 or 3 days at the latest, but it usually lasts a bit longer until their hearing returns to normal again. Complications of a middle ear infection occur extremely rarely in industrialized countries.
Uses a plate in Ecuador. More often it occurs in children for 7 months to 10 years. More than 2/3 of children experience one or more acute otitis media attacks of the age of 10 years, and about have experienced more than 10 years approximately of. Conclusion. Otitis media in children has a great value because more than 17% have in the working day present the same symptoms on using an antimicrobial treatment, amoxicillin.